After last year's massive $604 million boost for new medicines, this year's budget was an anticlimax for medicine advocacy groups, which are worried there will be no new funding for years. Some patients were even waiting outside Parliament on Budget Day last week in case there was good news to celebrate, but were instead left in tears. But there were celebrations in Nelson today as ministers visited for a hospital redevelopment photo op. Lloyd Burr reports.
A tour of the ageing Nelson Hospital with a nurse before the Finance Minister opened the taxpayer purse.
We will be spending more than $1 billion over this budget on new facilities, and I can confirm today that more than half of that will be invested right here in Nelson.
Health Minister Simeon Brown outlining the details.
This redevelopment will deliver a brand new 128-bed inpatient building for Nelson Hospital by 2029, 2 years earlier than planned.
Sound vaguely familiar? That's because it was already mostly announced last week.
Funding has been allocated for a major redevelopment of Nelson Hospital, including a new 128-bed inpatient building.
What her budget was missing, though, was another boost for medicines languishing on Pharmac's wish list.
I would describe the budget as a flatline budget for our health system.
Malcolm Mulholland's made it his life mission to get more life-saving treatments funded and was hopeful while waiting outside the Beehive on Budget Day.
Well, it was heartbreaking. I sat there with patients who were in tears because they knew that the drug that they needed funded didn't happen.
For those with the liquid cancers like blood cancer, it's particularly hard to stomach after this election promise from National.
We're sending out a signal to the people with myeloma and the people with leukemia. We understand, we haven't forgotten you, we just need that piece of work to be done by the Cancer Control Agency.
That work was done and released 7 months ago, yet still nothing.
The gap in medicines access that was identified in that report has not been closed for blood cancer patients in the same way that it has been for other cancer patients.
Associate Health Minister David Seymour has responsibility for Pharmac and in a statement says, "My preference is to secure as much funding as possible for Pharmac because we have seen what it is capable of when given the support it needs. However, ultimately, it is up to the Minister of Finance."
New Zealanders have a right to expect world-class health services.
The government re-announced and re-celebrated the uplift from last year. However, when we talk to Pharmac, they have confirmed that every dollar of that allocation has been spent, which means that the medicines that they have on their wait list, the medicines that patients still desperately need access to, are going to sit there because there is no new commitment to new money.
He says just to get to the midpoint OECD average of medicine funding would require around $2 billion of extra funding every single year. And in the meantime,
Kiwis will continue to go without, and as a result, many will die earlier than they should.
$500 million for a new hospital, but no new money for new drugs those inside it will need.
Lloyd is with us now. Kia ora, Lloyd. So Labor has come out with its own opinions on that Nelson Hospital upgrade. What have they had to say?
Yeah, the budget war of words continues. Labor's Aisha Verrill's come out and said, well, when she was Health Minister back in 2023, when she announced it, phase one of this upgrade, it included an increase of 92 beds. But today's announcement from the current coalition government only includes 44 extra new beds. So she's accusing them of cutting more than half of the beds from her plan. And then there's also the cost. So today's cost was $500 million. They won't tell us the exact figure because it's commercially sensitive, but around $500 million, right? If you look at Labor's plan that they announced when they were in government back in August 2023, it had a price tag of $1.098 billion. So around $1.1 billion was their price tag on it. So today's announcement is around half of that. However, Simeon Brown, the current health minister's fired back and he says, well, it was actually Labor who were the ones who asked to re-scope the project when they were in government back in August 2023. So there's a bit of a war of words going on, a bit of a brouhaha over whose hospital is better.